This vote was about upholding the rules of engagement when it comes to attacks on healthcare systems in armed conflict, that targeting hospitals and medical workers that are neutral parties to a conflict cannot be the new normal. The resolution condemns these kinds of attacks, demands compliance with international law such as the Geneva Convention, and also refers to such attacks as war crimes. Hospitals have increasingly come under direct fire in areas of war and conflict. In 2015 alone, the UN has verified 59 attacks against 34 hospitals. Now, that includes the U.S. strike on the Kunduz Trauma Center in Afghanistan last October, a facility operated by Médecins Sans Frontières or Doctors Without Borders. Similar attacks have also continued into this year. Last Wednesday, airstrikes in the Syrian city of Aleppo destroyed a hospital and killed at least 20 people. In January, a hospital in Yemen, also backed by the MSF, was bombed. And it was MFS President Joanne Liu who delivered an angry and emotional speech to the Security Council this session on what she described as an epidemic of attacks on health facilities. She called out 4 of the 5 permanent Security Council members for their association with coalitions behind these kinds of attacks: NATO in Afghanistan, the Russia-backed Syria-led coalition, and the Saudi-led coalition in Yemen, which receives support from the United Kingdom, the United States, and France. Now, in that light, this unanimous adoption of the resolution is a major step, but the resolution doesn't quite go far enough. The real test, according to Physicians for Human Rights, will be whether the Council will act when states fail to investigate and prosecute attacks on healthcare facilities and workers by referring violations to the International Criminal Court. Li Lingtan, CCTV, New York.